Hyperthyroidism is caused by an excess of the circulating thyroid hormones. An excess or too much of the steroid hormone will cause the body to have a hypermetabolism or very fast metabolism. Not only that, also increases the sympathetic nervous system. Keep in mind that the thyroid hormones directly stimulate the heart, so this results in increased heart rate, right? And a stroke volume that causes an increase of cardiac but on blood flow. Where are the main causes of hyperthyroidism? Is Graves' disease. Graves' disease is an autoimmune system in which our own body makes antibodies, right? And these antibodies attach themselves to a TSH receptor or a thyroid-stimulating hormones within the thyroid tissue, and when that occurs, the thyroid gland ends up increasing, therefore overproducing thyroid hormones. These patients will usually report a sudden weight loss or increasing appetite. Also, patients with hyperthyroidism seem to have heat intolerance. What that basically means is that their body has a hard time tolerating heat. So usually these patients will be sweating even when the temperature is fairly normal, and sometimes in the winter time they usually will wear lighter clothing than other people. In regards to the cardiovascular system, these patients will have tachycardia and is prone to have palpitations. So what as nurses can we do for the patient? Well, we can encourage the patient to get some rest, make sure that the environment is quiet as possible. Also, we can give the patient anti-thyroid drugs. Obviously, that anti-thyroid drugs block our hormone production, right? Or decreases the thyroid hormone production. Now, one of the most common drugs used are metimazole, which is tapazole, and propyltyrosol. Also take note that the most effective treatment for hyperthyroidism is the radioactive iodine treatment. The reason why this treatment is very effective is the fact that the thyroid cells are the only cells in the body which have the ability to actually absorb iodine. Now, what we do is to give the patient a radioactive form of iodine in which the thyroid cells which absorb this iodine will be damaged or get killed. In contrast, the most common side effect of this treatment is underactivity of the thyroid gland, which is what we call hyperthyroidism.